All right, let's get ready to rumble. Here we go. Here's the share. Talking about petechiae, yes?
Yes.
Score. All right, same deal. We are kind of going over everything. We're looking at sample questions. We're using the 7 principles. We're going to get a little bit into farm, a little bit of exit material. We're just going to crack it open and see what we get, okay? Hi, Beans. What do we think?
I think it's C.
Anyone else? Come on, participate. It's going to be okay. Listen, remember, this is a sandbox. This whole deal is a sandbox. So what I need for you to do is just relax, okay? So tell me what petechiae and ecchymosis is, or ecchymosis is.
Bruising.
Cool. And then what's it a result of?
Trauma.
Okay. Or think about medications.
Blood thinners.
Cool. So then what is the determinant for blood thinning? What do we look at to kind of be the detector if that blood's going to be too thin or too thick?
Like blood clotting.
Yeah, well, kind of, yeah. For sure. We're going to look at platelet count for that. So why is platelet count important? What is platelet count? What does it do? Look it up. Give it to Google. This is how we have to study, honestly. Remember, I'm not always going to be your professor, so we have to learn how to study on our own, and this is how we do it. We take an extra 30 seconds to look it up. What we got? I'm going to answer text messages while I wait. Anybody?
Don't they close clotting
Sorry?
factors?
Yeah, it measures the amount of platelets in the blood, and where are platelets important? Clotting factors. So that's why. And that's why it wouldn't be red blood count or hemoglobin or white blood count even. So why wouldn't it be hemoglobin? What does hemoglobin level do? We need to do this too, because this is also going to be advantageous to us on all of our standardized testing.
The hemoglobin shows how much blood you have, like, in your body.
How much blood do you have in your body?
Like, the hemoglobin levels, like, don't they show, like, the number of, like, say, like, if somebody has, like, a hemoglobin of, like, 7, they would need, like, a blood transfusion.
Yeah. So I get where you're coming from for that. So hemoglobin, does anybody else know why hemoglobin is important? This is a good point, honestly.
It carries oxygen to other cells.
Correct. So I want you to think of hemoglobin as like a lazy river at Kings Island, right? So you're on the lazy river and the donut is the cell, right? And then I, who would clearly be holding a cup of water, which is what this is, FYI, and I would be the oxygen, right? So what I do is I just chill along the line and just kind of float around and I supply everybody with oxygen. Does that make sense? And that's really important because when we look at those numbers, that's super huge because what happens if you deoxygenate? What does that do to your brain? What does it do to your heart? Talk to me. This is how we learn. This is how we study. This is how we make good answers.
They die.
Yeah, there's that. So what is it called when you lose oxygen in your brain? For those of us who love neurology, you really only have one answer and you can't go wrong. Oh, my students, please save the day.
Like cerebral hypoxia or something like that.
Oh my God, that's so beautiful. It makes me so happy. The birds, they fly. Right, we're talking about things like deoxygenation of the brain, like a stroke, right? Things like that. Cool. Sure. Can we move on to the next question? Want to give it a go? Boop. Hey, real quick, what kind of question is this?
An easy question.
Why?
There's fluff.
It's fluff and stuff, so it makes it look rough. But it's nothing more than a teeny tiny bluff. What is with me in the rhyming today? All day today. Somebody
Dr.
look at Dr.
Seuss.
Somebody pick up Dr. Seuss's birthday because I'm over it. I'm so over it. Sorry. This is what happens when you don't sleep. All right, what answers do we have, guys? What do we think?
Maybe D.
Okay.
C.
C. I honestly haven't even looked at the question. C. All right, so let's talk about it. A male client is admitting to the emergency department with vomiting of dark brown, foul-smelling emesis. Well, so that's the Cartman episode. All right. For those of you dorks, you know what that is. All right, so he reports he had a surgical repair of recurrent inguinal hernia 1 week ago and complains of intense abdominal pain. Yeah, I'd say so. So first off, what's the procedure that happened? Where is the inguinal area? I look like a pig right now.
Is it like the groin? Like the groin?
Groin. And then why do dudes get inguinal hernias?
Lifting?
They are men. They pick things up. Pick up. Put down. Man. And you know what? We love it. Whatever. Cool. So now that we've established that, we can establish a very, very simple point here, right? And what is that very, very simple point? That we have perforated this area, aka bursted open, because we probably picked up something we weren't supposed to pick up. Now, side note, this is also on your NCLEX HESI standardized testing. I've seen it. What would be the education for this patient post-surgical?
Refrain from like heavy activities?
Yes, aka doing what specifically?
Lifting.
Cool. This is a problem because most dads that have this issue work in construction factories, yada, yada, yada. They're usually in their 30s or their 40s, which means they have what? I'm surprised I don't hear mine in the background.
Children.
Children. And what do kids do when dad comes home because he's the man of the house?
Want help?
Hi, my name's Molly. I'll be your captain. This is how this works. Okay, so this is how you need to think about medicine. So what is some education we absolutely have to give again, which will absolutely show up on something very shortly? It is they need to refrain from lifting so much weight. Now that weight varies depending on the doc, but usually it's nothing over a gallon of milk for a hot minute there, just being real. Okay, now it does, again, it coaxes around. So now what are we thinking is going to be the answer for this? Assessing that his bowel sounds are hyperactive. So do we have movement?
Yes.
You got a whole lot of movement. Why? Why would he be vomiting? And then why would he be at the same time have a whole lot of movement in the inside?
Maybe a blockage somewhere.
Ah, and a blockage is called sometimes an ileus. All right. So what happens is your intestines, they do like this. They're like knuckles. And within the knuckles, you have more little fingers that do like this, right? So you got the villi and the microvilli. And as these little buddies are going along, every now and again, this little buddy gets kink in the road, which means I can move this and I can move these. But this little buddy is keeping me from doing anything. So that goes up that way, and that goes down that way. And all of this that's in here just kind of rolls around like a crazy person. And the only thing that can get through is this fluid, which is why people with an ileus have both diarrhea and intractable vomiting with poo smelling vomit. Make sense?
Yes,
Was that a good visual aid?
yes, it was.
Ta-da! Cool. Look, Ma, 2 hands. All right. So what do we think for the answer? We're going to have C. And yeah, insert an NG and attach low suction. Why? 2 main reasons. Number 1, what do you think?
Because of the vomiting and the dark brown foul odor.
Because that's creepy. Yeah, for sure. Yeah. Okay. And then the scarier reason being what?
To prevent aspiration on it.
Who wants to aspirate their own poo and die? Apparently Cartman. That's silly. Does that make sense? Do I need to explain the other ones out, or we got it?
No,
Okay, cool. Let me look at a hack really quick, see if we got any principles at bay. Anybody see anything? Okay, let me help. So this is the principle of passive versus active. The idea of passive versus active is this is a kind of answer, right? So place an indwelling urinary catheter and attach the bedside drainage unit. What's that doing for the poo and the throat? Nada. Passive. Give the prescribed analgesic for a temp above 101. Cool. It can come back with the poo. Passive. Not giving me any benefit, making it worse, actually, as is A. And then we have D, send the patient to x-ray for a flat plate of the abdomen. Guys, if I have a distended abdomen that is so large when I sit up that I am vomiting poo, what happens when I lay down? It's going to push it up farther, and then I'm going to choke for sure. No, that's a dumb idea. So by default, one of these things is not like the other, one of these things does not belong. The only thing that doesn't try to kill you is C. And in fact, if we look even further, we see that is the only active action that is going to take care of the problem. Now we good?
yes,
There we go. Sorry. I told you it takes a while because I'm trying to record for everybody. I know you guys are ready to blow and go because you guys are awesome and you've been working with me so much. We got to kick it down. I'm sorry. I'm sorry. So, oh, this is a good one.
A.
C.
I say D.
Oh yeah, D. A or D.
I still say C.
Does anybody want to give it a look-see and see if they can find the answer themselves? This is an interesting one. What do we think is the answer?
We all said A, C, and D.
D is the answer. Now, let's talk about it. What's the problem? Myocardial infarct. So myo is muscle, cardio is cardiac, heart. Cool. Done. Latin. La 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 la. Okay, cool. So then we have infarct, which means lack of oxygen. So lack of oxygen in the heart and specifically within the muscle. Cool. So now that we know that, reduce cardiac workload. I'm trying to reduce my muscles of my cardiac system to chill out, which means I am in a hyperexcitability state, aka a sympathetic nervous state, plus some. I need to drag her on down. How am I going to do that? How can I reduce workload? Well, let's look at it. Teach them to sleep in a side lying position. Is that going to do anything, or is that going to apply more pressure to the left side of my heart, which is kind of a big deal because it kind of shoots everything to the rest of your body? Yeah. All right. Provide a bedside commode. We'll go back. Encourage active range of motion exercises, aka trigger more sympathetics. When I'm lying down flat, I'm in a more rested state. My heart rate's lower when I get up and cook around because I'm feeling like a clown, Charlie Brown. Again, with the rhyming, I'm creating excitability and creating an influx of action potentials, which is creating adenosine triphosphate, which is then bathing the way for more movement, right? Big bad idea. Assist with ambulation in the hallway. Again, are we moving? One of these things is not like the other one. These things does not belong. Provide a bedside commode for toileting. Keep the movement reduced. Pivot them over, pivot them back. Heart rate goes down. Cool. Please acknowledge. I don't know when you guys want me to shut up when you're rolling your eyes or otherwise, because no one's got a camera on but me, and everyone's got something to say, but ain't nobody throwing their face out into the world 100% of the time, even when they're exhausted. So let me know you're feeling what I'm picking up or putting down, picking up, whatever. I'm exhausted. We getting it?
Yes.
Thank you. The one person, thank you. My two babies, thank you. Katie, babe, thank you. Molly, thank you. Okay. We can do this. Is this helping you guys, or am I talking too much?
No, it's helping.
Okay. There's a lot of things we talk about. We need to understand the body system process. We need to understand what's happening during that body system process. Then we need to paint the picture before we even answer the question, because then it kind of all unfolds together and we learn a lot in between that's going to be on other questions. So it's kind of important we kind of go over everything. And Beans is trying to catch the gnat. So this should be pretty fun. When the computer slams down, you'll know it's the Persian over here.
I would say this answer is B.
Okay. Anyone else? B. Very good. How did you know it was B?
I looked at all the other ones and they didn't seem to fit.
Okay. So I'm hearing that you might have used the principle of one of these things. It's not like the other one of these things that belong. Is that accurate?
Yes.
Score. Okay. Now, if we don't know what PUVA is, what do we see that makes sense? And we see psoriasis, which we know is skin, vulgaris, which kind of sounds like acne vulgaris, which kind of sounds like the word vulgar, right? Which kind of sounds like gross, scaly, vulgar skin. What will we assume PUVA has something to do with? Look more at the
Something skin.
skin and UVA. Okay, so these are the things that we pick out as we dissect. So what do we think?
B.
Mm, I'm gonna say A just because of the overexposure. Maybe like because of the papules. I don't know.
Let's give it a go. Answer is D.
Oh my goodness.
All right, so which assessment finding indicates that the client has been overexposed to the treatment? So overexposure. So brown, rough, greasy, wart-like papules on the face. What is that exactly? You know what I'm going to say? So this is how we play the game. We play the game of what makes sense and what doesn't. So would it make sense to you that brown, rough, greasy, wart-like papules on the face are going to be from psoriasis UVA treatment? Well, what does UVA treatment do? It's a bleaching process essentially, right? So if I have a area, I have to burn it out essentially, right? So the treatment is meant to basically burn down until we get to tissue that is no longer showing those mediators, right? We do it through a process, and there's multiple ways that we do it, and without getting into too much because it doesn't matter, that's kind of how it goes. So overexposure to that treatment is no different than getting a chemical peel, right? So what happens is some of these areas get too much of that and the pores suck in too much of that, and you will have these chemical peel areas that are usually around here, and it's very violent, and up under there are sometimes sores. So that would be an example of overexposure to that treatment. Does that make sense?
Yes.
Cool. So just looking at this really quick, brown, rough, and greasy to me sounds like it's probably some type of wart. Like what's the wart with like the brown like hair, like, come on, you know. And they're like the barnacle things. Well, I sorry, I don't do skin. I'm rough at it. Boom. Require sunglasses because the sunlight hurts the eyes. Yeah, okay, cool. Right. So there's one of these things is not like the other. One of these things does not belong pattern to that as well. Let's try this one. What kind of question is it?
An easy question.
Fluffy.
Oh, fat question. That's why we gotta make it so fat and ridiculous, because it's so easy. We gotta make it hard. Step right up, pay no attention to the man behind the mirrors. We're just throwing in a whole bunch of shenanigans so you can get it wrong. It's okay. What do we think? Thoughts?
C.
Okay.
I would say A.
Okay. Anyone else? Athena, stop it. B. So let's talk about this. What is a coarse breath sound? Look up what is a coarse breath sound. Now, this patient is what type of patient? A COPD patient. What is a COPD patient known for? Having oxygen saturations of 89%. Actually, 88. Yeah. So that's normal. Now, these guys, oh my gosh, I'm worried, scared to death about this 100.5 degree temperature. Why? It's an infection. No, it's not. It is a result of your body becoming cacaxic. That is little teeny tiny guy with the little bitty ribs in between and nothing in between the intercostal spaces, but skin that does like this in between. Thank you, Athena. She decided, yeah, she decided I needed a Capri Sun to open for her. So give me just 1 second. Athena, Nicola, Isadora, Ophelia, Newman, I swear. Go girl. No, really go. Go play with your sister. I'm watching you. Sorry. Okay. So coarse breath sounds. This is going to be different. Shortness of breath on exertion. I got COPD. What do COPDers do? They tripod because they got shortness of breath on exertion. What is exertion for COPDers? Well, it depends on what stage they are. It can go anywhere from I can walk to the mailbox to I can maybe walk to the bathroom. That gets a little dicey. Kind of like my child over here jumping up and down while I'm trying to record. I'm just playing. I love you. Play. Go be a kid. Shh. Microphone, I'm talking. I'm recording. I love you. Guys. And we're not dead. Okay, cool. Sorry, they're over here playing while I watch them. So let's see. Where was I at? Help me out because brains and whatnot.
You asked us to find out what coarse breath sounds mean.
Correct. And what'd you get?
Pneumonia, crackles, bronchitis.
Why are all those things fearful specifically with a patient? Oh, and I remember where I was just at too. Sorry. All of these items imply that we could have further occlusion, aka we could lose further oxygenation, aka lose further windpipe, and then respiratory collapse. Does that make sense? It's kind of like that whole course turns to stridor very shortly. Does that make sense?
Yes.
Okay.
So bilateral diffuse wheezing, what do we find that in? And then yellow expectorant sputum. I'm not concerned about an immediate intervention with that. Bilateral diffuse wheezing, I would expect when we have things like emphysema, when we have things like COPD, shortness of breath on exertion, I would expect yellow expectorant sputum. I would expect. What I would not expect is coarse breathing, because coarse breathing is different than bilateral diffuse wheezing. Bilateral diffuse wheezing is because we have scarred and striated this tissue for so long, it's going to have weird little holes in it and give it the whistle effect like a pan flute, no? So it kind of does that as you're going in and out versus a course, which is more like, does that make sense?
Okay. Thank you.
Yes.
No, that was
First,
weird. And
yeah.
hi, I can make flute sounds. Woohoo! Welcome. Check on the resume. I'll add it at the bottom of the list of achievements. Okay. Like, yeah, that's exactly. Autism, like we just know sounds. We get sounds because the pitches and it. Yeah. Okay. Just let it go. Okay. Shut up, Molly. Just move. Okay. Great. Here we go. Perfect. All right. TERP procedure. Whenever I see the word TERP, I already know where this direction is going. I will tell you why here in a second. We will talk about the few questions you will get related to a TERP. Charlotte, are you watching? Are you watching a video while counting backwards and jumping? Good job. That's impressive.
I would irrigate.
Okay. Anybody else?
I would say C.
Okay. Answer is D.
Marcia, we're not getting any right.
Nothing.
First off, do you know anything about a TERP?
No.
Absolutely not.
So let's explain the procedure first. So we know about people who have BPH, right? They have really big prostate. Well, the problem with that is we got the urethra right there. So what happens is that as that prostate gets so large, it actually closes it. Charlotte, can you go grab Mama a straw real quick? Grab a straw from the drinks. Go grab a straw. Hurry, hurry, hurry. I'll be back. So yeah, transurethral resection of the prostate then takes the prostate out, removes it, that's a problem because that boy is bloody, right? Duh. So we have this issue where we could potentially clot and then just make the issue even worse. So rather than, of course, it's going to be the one straw that doesn't squeeze. It's okay. I love you. It was fantastic. So we're going to pretend to squeeze this because the prostate and it clots off. So what we do is we free it back up so they can free flow. And when we do that, we have to make sure that we don't get a clot within that system because it's going to get worse and then we're going to get them sicker and they're going to die. So this continuous bladder irrigation is a system that we use to continuously irrigate the bladder. Now, how does this get dicey when we talk about urine? Well, that's one of your pharmacology things that you're going to have to do because that's an I&O question that is very pertinent to whether you have to manipulate things related to the term. So it sounds like a lot. It really isn't. It's just a matter of understanding color. Okay. Here's how it works. If it's too bloody, you need to turn the fluid up. You need to make it a pink tingy color. That's your jam. If it's clear, you need to back her down because at that point it is too far, too high. Your patient's going to get cramps. It's going to hurt like the blazes and they're going to want to punch you in the face. And probably for the love of cheese and Pete, you probably deserve it because you should have known not to turn it too high. Does that make sense?
Yes.
Cool. So now what do we think the answer is?
Let's see.
Understand why it's D?
Yes.
Okay. We don't want to get into a position where it gets so clear because we're trying to clear clot that they start getting those nasty cramps. And then of course, if it gets too bloody, then we got too many clots and then you're going to have surgeons gonna be really, 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 really angry with you and they won't fire you. No, because that would be too easy. No, they'll treat you like a child for the next 5 years of your life. I don't know what that feels like. Guys, I'm not a genius because I'm a genius. I'm a genius because I'm a failure at being geniusly wrong. Okay? Don't give me too much credit. I'm cool. I'm not that cool. I'm just a human. All right.
See?
E.
I'm going to say B.
So C, and then let's talk about it. All right. So the nurse assesses in the adult 24 hours after a bowel exploration. What is a bowel exploration? And formation of sigmoid colostomy. Well, what it really is someone has an ileus that can't get fixed. Someone has Crohn's, colitis that is just out of whack, can't get fixed. So we have to go in and we have to put in a colostomy. Now, colostomy is not as scary as it sounds. It's kind of like a hole punch that you're punching into a piece of paper, right? So the procedure is very quick. They basically just find the piece of intestine. They hit it just like you're getting your ears pierced. And then they just put a little device on it. And then that is your means for the beginnings of a stoma. Now, it's not all peaches and cream. There are more things involved with it, but basically that's what they do. They pop a hole, they roll it through like when you roll your socks into a tube, same concept. All right, so now that we know how that looks, we need to know how to maintain it. So what are we concerned with? Well, the surrounding tissue, because if that surrounding tissue dies, it starts to die from the inside. And by the time you see it's dying on the outside, it's too late. That's kind of how this works. So as soon as you start to see anything act funky on that stoma, AKA it gets like purple, it goes black. Black and purples means necrosis, means trauma, means blood exchanges. And right in that area, there's no balance. There's no equilibrium. We have a problem. There are no bowel sounds in the left lower quadrant. Well, it says it's a sigmoid colostomy. So would that necessarily be the case? We're 24 hours after a bowel exploration and formation of a sigmoid colostomy? No, because this is fresh. So what happens is the brain receives that information that is being attacked by way of surgical incision, and it goes, WTF? I'm going on strike. I'm evacuating the city, right? It's Pompeii. And then they roll. And then everything else just kind of goes into a ghost town. Does that make sense?
Yes.
So we have to watch out for a few things. We have to watch out for the color. It needs to be pink. It needs to be moist. I know girls hate that word. I don't know why. That's weird. I think a freaking golden cake. That's amazing. That's moist. Yowzers. Fantastic. Whatever. Throw some pineapple on it. Done. Okay. So we have that. It needs to have some type of free flow. We have to measure eye and nose on it. We have to measure the consistency of it. What is the consistency going to look like as we go down the pipeline as far as ostomies are concerned? Is it going to be thicker up here, thinner down here, thinner up here, thicker down here? How does that look?
Thinner at the top, thicker at the bottom.
Believe it or not, no. It's the opposite. And let's think about it for a second. I'm eating a pizza. Yum. Perfect. Pizza goes down the belly, right? It settles. Now, is it liquid down here? It's right here. Epigastric. Bloop. Epigastric. Is it liquid? No, it's just a whole bunch of pizza bits, right? So if I therefore have an ostomy right here, it's going to be pizza bits. Now, if we get down lower, by the time all of those villi and microvilli, those little knuckle buddies, right? So we're moving down the intestinal pipeline, and down here, all these little guys grabbing. What are they grabbing? They're grabbing nutrients, right? And as they're grabbing nutrients and taking them away from all the poo going down the pipeline, all that's left is water, which is why when you go lower, it's liquid. So I remember lower liquid. And then I remember, how did I remember the other one? Was it upper ugly? Was it epi? There was something with the E for epigastric. I don't know. You'll figure it out. But you got half of it, right? So lower liquid. And that's your hack for that. Does that help? Other than that, there's not a whole heck of a lot that comes up related to stomas that I can think of, other than making sure it doesn't die, notifying the doctor immediately if you notice it's purplish. Purple is a problem. And then sometimes they leak, but you have to fix them. Remember, the intestinal tract is very acidic, so it burns the skin like crazy. So maybe you have to do some education on that, but other than that, that's it. All right. This one. What kind of question is that?
Fluff and stuff.
Cool.
B.
I would say C.
Anyone else? See. Now, let's talk about it. A young adult male has a leg cast following an open reduction for fractured tibia. What does an open reduction for fractured tibia mean? We know the tibia, it's in the leg, yeah. So that's not good. It's fractured. And then we see open reduction. What do you think it means? Based off of just that. It means that we got some bits and some bobs in there that need fixed, basically. Okay, open reduction for fractured tibia means that we got to put some plates and some things. We got to stretch some things out because things have been reduced. Okay, there's a lot more into it, but basically that's the gist, and that's all you need to know. He is in skeletal traction with 10 pounds of weight. Approximately 2 hours after returning to the unit, he reports severe pain in the affected extremity, and the nurse observes that the limb is blue and blanched. Okay, which action should the nurse promote first? Well, let's think about this. So I have traction attached to my leg that was just fractured. And what we're doing efficiently is we are grabbing this and we are pulling it with that 10-pound weight back to this so that it can kind of set and do this. Does that make sense? So why is this good or bad if it is blue and blanched? What does blue and blanched imply?
Not getting any blood supply.
Oh my God, right? What happens when I go stand outside in Alaska and it's negative 38 degrees? Okay, I turn into that. Why? Because I'm cold. Why? Because all of those little capillaries and all those little buddies that are feeding that area have to make a decision. And the decision is, do I let my skin go stupid blue and save the heart? Or do I just let the heart die? And that's a no-brainer, pun intended, boom, because the brain goes, hey, idiot, I know you're just the heart, joke to cardiology, pun intended to the bestie. And the problem with that is that doesn't matter. I need for you to feed what matters, feed that little heart, make it go dunk, 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 and let the skin go. We're cool. Make sense? So
Yeah.
if you didn't know all those things, one of these things is not like the other one of these things is not long. This, see, implies that something is bad and we're doing something to fix it. We're calling someone. Record the observation and check the limb every 15 minutes. Delay, passive. Administer PRN pain medication routinely as prescribed. Hey, little buddy, you're losing your leg. Let me tell you what, have a Tylenol. No, not. Release the traction and notify the healthcare provider. Listen to me, friends. Get very close. See the wrinkles? I don't care. See every last one of them. If you ever see a question and the answer is to remove the traction, my friends, if I know you and I know you've watched this video, and I know if you've watched this video, I really don't. If I find out, I'm gonna be very disappointed because that is never the answer to anything. That is the worst nightmare. If you want to get screamed at and yelled at, go ahead. I don't want to be within earshot. I've seen it happen. It goes so stupid. That will never be an answer. Kick it off. You already know you got a 25% reduction in missing the wrong one. I think that made some sense. You know what I mean. Don't do it. It's dumb. All right, next question. I think this will be our last question. I got kids that got to get to bed. So I'm going to do that. And then if you'll give me maybe 15 minutes of a break, I can jump back on and we can continue to do this. Is that cool?
Yes.
All right.
Yes.
This is helpful. I really like doing this. I mean, yeah, it's misery because we're all tired and kids are running about, but like, this is what nursing is. Like I said, it's a lifestyle. You get to see every different Molly. You get to see corporate America Molly. You get to see, hey, people are doing stupid stuff. So I got to play stupid games, win stupid prizes. Hey, Molly's got a soft side. Hey, Molly's a freaking 10-year-old child. Like you get to see what the deal is because a nurse is many things to many people. A nurse has to become selfless and be whatever is in front of them and be that mirror image to help inspire them for change. So joke's on you, because I've been teaching you how to be me all along and deal with being me and to see what it takes to be me. You guys know all the faults and the flaws. You guys know the pain I have to deal with. You guys know that I carry it with poise and confidence. You know, sometimes that looks like I'm cocky. It's a balance, guys. They don't know everything on the inside. I know all the inside stuff about you guys, right? That's why we have these discussions and these heart-to-hearts while we answer questions and have a little bit of fun. So thanks for having time with me. I appreciate it. I really do. I'm very grateful. All right, it's getting too weird. Go ahead, answer the question. Softy. Shh. Gross.
B.
Okay. What else? Everybody on B?
I guess B.
What? What made you say that?
Leuko and just chemotherapy.
I'm sorry, was that what language is that?
I said just leuko and chemotherapy, carcinoma.
What's chemo mean, ma'am? Ma'am? Chemo?
Build white blood cells.
Chemo, like chemical? Like Latin? A little bit Latin? A little bit Latin? Okay, fine. Beautiful job. All right. I said that was gonna be our last one, but it's 8:51. Do you want to do this one and be done? I might have said
Yes.
that 2 questions ago. I don't even know. I'm just kind of rolling on steam at this point. Fumes. Although I feel like a train hit me. I think we all do, don't we? We're all over it. 2 weeks ago, we had lashes on. We looked beautiful. Our hair was coiffed. And now we're just like, put a bandana on and call her Rosie the Riveter, throw some mask in the back and do it. Actually, this is just my kitchen. This is my dining room. It's always this way. Sorry. Come on, we got one more in us. 1, 2, 3, go.
I would say this is B.
And
Okay. A. All right. The nurse is planning care for an older adult male who has experienced a cerebrovascular accident, I'd say so, several weeks ago because of expressive aphasia. What is expressive aphasia?
Unable to speak.
Awesome. And then, ooh, bonus question, my child. Is it Broca's or Wernicke's? And what side of the brain is it on?
I want to say Broca's.
Science. Hey, Broca's means broken speech. Okay. So if I'm expressing my speech, then that is expressive aphasia, no? Somebody double check me. Somebody double check me. I might be doing that thing that I do where I play stupid games and win stupid prizes. All day long, friends, all day long. Got a whole nother cup of water. Guys, you never know if I'm telling you if something's right or wrong, if I'm asking you questions like that, because if I keep giving you the answers, you're just going to suck and feed on the answers, not going to suck and feed on the concepts. I need for you to understand the concepts, which means I need to train you how to do it, which means through Pavlovian movements and basic science, I am able to control your habits and behaviors, aka flip the battery of the bad habits so that we can better learn how to study. And we do it by me making you do this stupid stuff, us having to delay, everybody watching YouTube right now going, could you just hurry up? Putting me on double and everyone's pissed. But here's the thing. Be pissed all you want because I'm the one to be pissed at. Because remember, I'm never going to go anywhere. I'm always going to be here so long as they don't like have me sent out by security. And I know that guy too. So I think we're okay. Like, do the work. Trust me, I did. Ding. It worked out pretty cool. And counting. What do we think? Expressive aphasia. Broca's or Wernicke's. Left or right side. These will be on your NCLEX and your HESI and your standardized testing. Come on, ladies. Athena, you need to stop. We're almost done.
Left side.
Left side, strong side. Good. So Broca's means broken speech. Broken speech means I cannot speak. If I'm expressing speech, it's expressive aphasia. Wernicke's is just slightly posterior. It is speech reception, Wernicke's speech reception area. So what Wernicke's speech reception area means, I am receiving speech. Therefore, that speech reception sounds all gobbledygook. Okay. An example. You are talking to me and you say the following. Hi, Molly, how are you doing today? I hear Hinshkai Makala Kulaway, right? Which means, yo, fantastic for you, right? Whereas the inverse happens if it is Wernicke's. Does that make sense? You need to know that, and you need to know it's on the left side because they will tell you sometimes that a person who has expressive aphasia has right-sided weakness or left-sided weakness, and you have to know the expressive aphasia is on the left side, which means they're going to be what side weak?
Right
Right.
side.
Thank you. So this is how this works, and those are all your questions related to those things in a row. All right. We're going to be done for a hot minute. I need a break. Kids need to go to bed. It's been a wild ride today, but you know what? Let's just keep on moving. How's a 20-minute break and then back on? Is that cool? Or are you guys just done for the night? If you are, down. Cool. What do you want to do?
I
I
don't
have
feel
to
good.
get my kids to bed too, so if I can get back on, I will.
Everybody, oh, we're going back on or we're going to bed?